I think everybody is in.
So you want me to start, Liz? Okay. Welcome, everyone. Usually John Mers is sporting a snappy hat and our host for the COVID office hours, but he is actually either in or on his way to Iceland. So I am wearing the sporty hat and will be your hostess for today. So thank you everyone for joining us on the COVID office hours for the month of July. We have some updates, some presentations, and then Whitney Wilfred, thank you, Alice, will be presenting on grief and trauma. So without further ado, we can just start and let Whitney have the floor for most of the meeting today. I'm going to kick it over to Steve if there's any Department of Housing updates.
Thanks, Alice. So just your typical updates on where we are with some of our funding. So as many of you know, DOH received 380 vouchers for emergency housing vouchers to go to the homeless population. So we're in the process of working with the CANs to get those folks matched up. So we have released 200 of those first, because we know that there are other housing authorities throughout the state that are receiving those. So we want to make sure that those get utilized as well before we release the second batch of the DOH ones. Clearly it takes time right now to get people housed. So we just want to make sure that we're going on the process. In terms of our CARES Act funding, the last piece of that needed to get contracted out is the second tranche of rapid rehousing, which we're in the process of doing. So once that gets completed, then all of our CARES Act money will have been out into contracts, which I think is a really good thing. With a year to go, we'll continue to spend that down. So I think right now that's about it. Everything just keeps moving forward. Thank you to all the providers out there who had a DOH contract that needed to have extensions done. I know we asked you to do a lot of work and get it back to us very, very quickly. But in the end, that benefits not only us, but also our providers as well. So we don't have to start the whole process over new. And I'm happy to say that out of the 85 contracts, 83 came back and we're done. So we're very, very happy. So once again, thank you all to the providers for bearing with us and putting things done really, really quickly. So I don't want to hold up anymore. So I'll turn it back to you, Alice, to give it over to Whitney.
Actually, we're going to have John Parker present on Unite CT.
Perfect, thanks. So Unite CT, we are rocking and rolling now at this point. We've served 3,145 households with just under $24 million. And if you aren't following along, the website is really comprehensive and we have our dashboard. The dashboard gets updated every afternoon during the week. And there's an interactive map on the dashboard that shows you like your towns and how you're doing and where towns aren't being served yet. And so I would say definitely for people to take a peek and really think about the nonprofits that are in the community and making sure that they are communicating out that Unite CT is here. There was an executive order on, it was yesterday that it came out, that it was published. It was on the night of the 30th. And basically anybody who's being served a notice to quit that is for non-payment, nuisance doesn't count, like that's a whole different ball of wax. But basically anybody who's coming into the court systems, we want to ensure that they know that Unite CT is available for the landlords and tenants to rectify if there's money, that's their issue. So everybody, all landlords will need to submit an application and have a case number for that notice to quit to be served. And then the courts are waiting for 30 days to allow that process to occur so that the household can try to resolve the issues before they move along in court. That's really huge. Unite CT has an entire, this is so close, you know what I mean? This is like the homeless prevention part of what this program really is doing when we're preventing the evictions. So we have an entire team through the process that's focused on evictions. And each of our Unite CT resource centers, there are 16 of them in the state. They have an eviction specialist that's assigned to help people on that local level. because if the situation is no longer affordable, if the tenant and landlord are not going to resolve, whatever the case might be, if the person needs employment, if they need to relocate, if they need mediation, those resource centers are the place. They're the go-to to get that type of help. So that's going to be really important it's a part of what we do at Unite CT. It's about 14% of who we're serving right now, but still they're the eminent and they're their next potential homelessness. So we want to intercept those households. From your point of view with different preventing homelessness or people who are exiting homelessness, if their lives were affected by COVID, you really want to do an application to Unite CT. Unite CT has changed where the maximum amount per household is $15,000 of financial support. So we will handle arrearages and prospective rent. The prospective rent is every 3 months you recertify. But what's important, I think, for the work that you're doing is that we can do a security deposit in 3 months forward for people. So if something has happened and people are couch surfing, if they lost their job, they moved in with their family, they have a new job, they're ready to get back on their feet independently, we can help them with that move forward too. So I think there's creative ways that all of you can be thinking about Unite CT and how that helps the people that you're serving. So definitely keep track on the website for updates. And if you have any questions or anything like that, we have the Unite CT resource centers that are scattered, that are really the boots on the ground. They're staffed with people to help. So reach out to them.
So Dawn, Karen Fatoma wrote a little note in the chat box about, I don't exactly know what it means, but you recently met with class and please update them on this. This is huge. So I want to do my due diligence.
And you know what, and we are moving around the state with different presentations and everything. We are all the communicators. This is too big of a program. It's, almost $500 million for Connecticut. We're all the spreaders of information. The website constantly, we have video trainings, how-tos. We're doing presentations to landlords and attorneys and all kinds of people. So anytime that there is an opportunity to do like a presentation to a large group, let me know. And as far as like updates, we do not do a listserv update system. Like we really are saying, go to the website because that is where everything is the most current and accurate we can't like keep up. I don't want to miss any groups or anybody. But the website is definitely comprehensive and the go-to for what's happening at Unite CT.
Thanks. Excuse me. Thanks, Dawn. Karen says she will tell them to look for these updates. So thank you, Karen. Really quickly, I just wanted to update that at DMHAS, the DMHAS waivers, the COVID waivers expired on June 30th and we did not extend them. However, the HUD waivers that were in place by HUD are still in effect. And Lisa Callahan is working, excuse me, Lisa Callahan is working very diligently on getting everybody out there HUD grant amounts, grant agreements as we're getting them in from HUD. There are some that are still outstanding. HUD has not signed and sent them to us at DMHAS to sign, but those will be coming out. So keep an eye out on that. And as you know, we would like you all to track your expenses on the expenditure report that we developed. So Lisa's sending that out as well. So those are the DMHAS updates. I'm going to turn it over to Amber Freeman from Connecticut Coalition to End Homelessness really quickly for a quick update, and then we will hear from Whitney.
All right, thank you, Alice. So hello, everyone. I just have a few updates on HMIS. Due to COVID, everything has been virtual. So we did allow to have a verbal release of information. That feature is now permanent. So now it is a permanent option to have a verbal release of information in HMIS. Of course, we want to continue to encourage You have a written signature and a written release of information. However, it is not a requirement anymore. So in HMIS, there would be an alert that will appear on the dashboard for when there is only a verbal release of information. These releases of information are also good for 1 year, and they can be renewed. It is a permanent feature that will be in HMIS. So there's also will be a drop down in HMIS to indicate that a verbal release of information was accepted, and it's no longer mandated to document the verbal release of information in case notes. Another great feature with HMIS is that as of yesterday, the by name list version 2 is now live. So basically with the new by name list, it will allow you to see all individuals that are experiencing literal homelessness, not just those that have a BI-SPDAT score. So it makes it easier to see everyone in the system. Release notes have been sent out, and there is more information and more details on that. But for the sake of keeping these updates short, that is all I have. So thank you.
Thanks, Amber. So I would like to turn it over to Whitney Wilfred from the Climbing Out. I just want to make sure I get it correct. Climbing Out Solutions. I was right. Whitney's a licensed clinical social worker. She works with a variety of folks in recovery, children, using different modalities. I'm going to pop the website for Whitney's group in the chat in a minute. I don't want to delay her presentation because it's going to be fabulous. It's on grief and trauma, which I think we have all experienced in the last 16 to 18 months. So we really do appreciate Whitney taking the time, and I don't want to steal any more time from her. So I'm going to stop talking, and without further ado, Whitney.
Good morning, everyone. I thank you so much for allowing me to come and just be a part of your staff meeting. I also want to inform you that you did a beautiful job, Alice, introducing me, and also using the adjective fabulous to talk about grief and trauma. I thought that was pretty awesome because I think it's such a necessary and also a very sobering topic to talk about during this time. We have experienced so much during this pandemic from 2020 and also going into 2021. Before we go into objectives and all of those different things, I just want to invite you all to really just find your breath and to really concentrate on your breath. And if you would, I would like to give you a definition of mindfulness to allow this to journey with you throughout this presentation. I can get very passionate about speaking about trauma, but especially grief, because there is a trauma that is also married to grief, especially at the rapid rates in which we've lost people during this time. So the definition that I would like to submit to you, and if you want me to slow down and give it to you another time, I'm happy to put it in the chat at the end, but I also want to be mindful of your time. And so I like to say that mindfulness matters. And what mindfulness is choosing to pay attention to this present moment on purpose without judgment. I'm going to say it one more time. It is choosing. So it's a decision to pay attention to this present moment on purpose without judgment. I submit to you today that our ability to be present focused, willing to lean into tension and honor joy will matter in how we care for our patients, but it also matters in how we choose to care for ourselves. So before we start and we go into our objectives, if we can go to the next slide, I'd like to observe a moment of silence for those that we have lost within this time. And often we'd like to refer to this as a dual pandemic. And so I'd like for us to get those people in mind, to get ourselves in mind. And just at the sound of my gong, for you to take 3 seconds to observe that moment, and then allowing yourselves to come back to this moment. And if we can go to the next slide, I hope that we're all doing well and that you have your breath. Today, what we'll be covering is first, what is grief? Then we'll touch on defining trauma. We're going to talk about a little bit about traumatic bereavement. We're going to talk about intersectionality and if it matters in the discussion of grief, as well as acknowledgement of this dual pandemic of the COVID-19, and also the systemic racism that we also have experienced within our community. And lastly, care for the soul. I chose to take a little bit of leaning away a little bit about grief in our subject title, because I really want us to lead with understanding the need to care for our own souls, because the things that we do for us, it needs to be first, so that we can be able to give to our community and give to our patients first. So it's just that oxygen mask concept, and it's so hard for us to do that because we work from such spaces of deprivation a lot of times when we're giving to people, but it's so important that we care for our souls first. So at the next slide, what we're going to do is we're going to define grief. But before we do that, I want to offer up a story of my own. And I want to encourage you to also to get your own story. But I was working, and I see a friend of mine in this chat too, Tabitha, hey girl. I see her in the chat, but I used to work in an in-home program, and I had the pleasure of working with people from 6 to 9 months. And because of that, they became like family to me, because I would even oftentimes work with them longer than 9 months. And so today I'm going to tell you about it. I'm going to give you a story. And for privacy arrangements, I'm going to call her Slick. Because that would explain her personality to me. So at 8:15 in the morning, the counselor woke up filled with uncertainty. She laid in her bed for another 10 minutes, which seemed like 2, and accepted the first text message of the day. It read, "We can meet at the funeral home by 10:45 a.m. and walk through together." She texts back, "Sounds like a plan." Loss is always something she considered in the work, but never did she imagine this would be her. The counselor met Slick in March of 2016. 5'2" African-American slender woman with shoulder-length dreads and a clapback game so strong, she'd make you want to start your whole day over. Currently separated from her husband, 3 school-age boys and 1 daughter in school, Slick lived closely to her family. Literally, one sister lived across the street. Another brother often walked around in the neighborhood, and her mother lived down the street. Now, I don't mean down the street since you have to jump on the highway and it takes you 6 minutes to get to your mom's house because it's the next exit from where you live. No, I really mean down the street, about 6 to 7 houses down. Despite the proximity, she always spoke about her family and friends as if they were so far. She would have something wise to say about her siblings, but seemingly the first to open her doors, pick up her phone, or open her wallet when it was needed. On the first session, Slick tested positive for alcohol and could barely put words together. The DCF worker remained present and followed safety protocol for the children's well-being. The protocol meant Slick's husband shows up and takes the boys to his apartment. But where does the daughter go? At this time, Slick took the worker. My mom told the worker that my mom is in North Carolina, so she can't be here. Slick's sister was notified by the counselor and the daughter remained with aunt. After several minutes, the paramedics were called. Before they even arrived, Slick agreed she would allow them to come in the house and she would go to the hospital if she found it necessary. When they arrived, she immediately began to refuse any further medical attention. Now, Slick also carried a medical diagnosis of diabetes, high blood pressure, issues with inflammation, and what the counselor would later find out is cirrhosis of the liver. The counselor met with Slick at least 3 to 4 times a week, not including on-call emergencies, as well as meeting with her husband 2 times per month to be sure he was supported. He was supporting the children. There were countless meetings with the family and transporting Slick to almost all of her medical appointments. The more time they spent together, the more Slick unraveled about her marriage and the abuse within it. The more time spent, the more Slick unraveled about her concern with her daughter and wanting her kids to come home. The more time they spent together, the more family the counselor would encounter. The counselor began to witness restoration within the relationships between Slick and her sister that lived across the street. Remember her. As time passed, Slick's clapback sound a little more like hope, because when her mother returned home, this gave her great comfort. And around this time, Slick's children transitioned to living with their grandmother, who lives 6 to 7 houses, bringing the kids a lot closer to her home. Slick tried to stay away from the bottle. She even began to get honest about where she lived and it being problematic if she wanted to be sober. Slick shared her truth about her health, truth about the well-being of her children. She even began talking about living more. Slick had more hope talk, is what I like to say. However, within a 2-month time span, Slick went to the hospital 6 times due to intoxication and inflammation. In a matter of 3 months, all of 6 medical services were now in home. Slick could no longer walk long distances. Her knees and ankles and stomach were constantly inflamed. Slick's health was up and down, and so were the kids emotionally. The counselor made sure Slick honored her in-home medical appointments and continued to seek out secondary opinions about Slick's health. Slick still would not stop drinking. The counselor and Slick met on the Thursday and scheduled to meet up on the upcoming Tuesday. On Sunday, December 24th, 2016, seated in the car, the counselor dropped the phone and tears fell. Slick was found dead in her living room by her youngest son. 2 weeks later, the counselor accepts the text. We can meet at the funeral home by 10:45 and walk through together. 6 months later, the counselor accepts another call. It's Slick's mother. The kid's father is gone. Can we discuss grief without first discussing trauma? If we can go to the next slide, I'd like for us to give some definition to what grief is. And I also just want to check in if somebody can just tell me that they're still with me and that you're all right. Just tell me that you're good. Give me a wave. Give me something to those who have their cameras on. You're good. Okay, good. And so the definition that I'd like to submit about today for grief is the normal and natural response to loss of someone or something that has died, where a bond and affection and love lives. We can go to the next slide. I'd like to talk a little bit about Paul Tillich, and you don't have this in your slide, so if you want my notes, I'm more than happy to give them to you. Paul Tillich is the author of Systemic Theology, and he explains grief as a deep existential fear and yearning. It's the condition of estrangement. Dr. Hart Ramsey says, grief is love's last stand. Grief is the process of what adjustment feels like. It is bringing us to terms with what was, what is, and what will be. It is moving from one state to another. As we continue, I'd like for us to also consider the 8 dimensions of wellness. I know that I have some DMHAS folks on here and we have some, and so do we all know what that 8 dimensions of wellness is? I'd like for us to consider the physical, the cognitive, the behavioral, the social, the cultural, and the spiritual and philosophical dimensions as it relates to grief and loss. Kubler-Ross speaks about the stages of grief. And if we remember the people in which that Kubler was studying, they were under the patients that she used, they were going through terminal illness, right? And so some of the stages I love. I like to call the acronym I'd like to use is DABDA, but I also like some other things that were constructed into the different stages of grief, and also some things that she's also advanced on in terms of her stages of grief, because it's beyond those who are just terminally ill, as we know, going through this pandemic. The first stage of grief is she identifies as denial, right? Denial or shock, right? It's a state of belief, of disbelief, and you can also, in this stage, feel numbing feelings. The next stage is pain and guilt. And this is the loss is seemingly unbearable. And the thought you're making other people's lives harder because of your feelings and your needs, right? Sometimes when we acknowledge our pain, we acknowledge the need that we have for community, we acknowledge the pain and the hurt that we feel. And now we also are burdened with the need of needing others. And sometimes that may feel like we're going to be a burden to others, but it's also the need for, we have to respond to that pain by also reaching out. The next stage is anger and bargaining. Anger and bargaining may look like lashing out, telling God or your higher power that you'll do anything they ask if they'll only grant you relief from these feelings. The next stage is depression. This is a period of isolation, loneliness, during which you process and reflect on the loss. Depression is not to be equated with sadness. Sadness is something momentary. Depression means that I am not enjoying things the way that I used to enjoy. I'm struggling getting out of the bed. I may have felt this sadness and this sense of loss for chronically, which can be over 2 years. Depression and sadness are different. I love the way that we include in this newer phase, the upward term. And this is described as a more calm and a more relaxed state. The next one is the reconstruction, and working through the pieces of your life coming back together and carrying forward. And lastly, acceptance and hope. This is a very gradual acceptance of the new way of life and a feeling of positive possibility in the future. If you'd like to have these stages, please let me know. I'm happy to forward them over to Liz. I also want to bring attention that no one experiences the same thing, and grief is very personal. And you may feel something different every single time, and that these stages that are being discussed they're not experienced in any chronological order. We may go back and forth, right, with things. And this next slide, I just want you guys to be aware that today of what we will get out of this session and what we probably won't get out of today's session. Today, I just want to be honest that I don't have a formula for people to get past grief. But what we can begin is the conversation and take away tools to help you journey personally and alongside others. That's what I can help with. And my next slide, I want to highlight a amazing evangelist. Her name is Marissa Farrow. And what she says gives very much point to the question of how can we discuss grief without discussing trauma? Next slide, please. Marissa Farrow, who is a journalist, says that grief in this country has always had an equity problem. And 2020 has only amplified the issue as Black deaths have come in back-to-back blows, from the coronavirus, police brutality, and the natural deaths to those we look up to most. Each new death, each new example of an old injustice renews our grief, sending like little shock waves of sorrow. So to certain communities, this has only been a heaviness and also a dualism to how they have experienced what they already know to be sorrow, what they already to know to be sadness, what they already feel isolation and loneliness, but this only increased it. How can we discuss grief without discussing trauma? Dr. Gabriel Mate, he was also in a documentary called Uprooting Addiction. He gives a very great definition of trauma. And what he says is that trauma is defined as an internal dynamic induced by external circumstances. Sometimes trauma, we can't see all the trauma and we equate it as somebody being hurt physically, but trauma also includes neglect, sexual abuse, loss. These are traumatic. The individual's response and the impact is what is being addressed. In our next slide, we're going to go over a little bit of what traumatic bereavement is. And this is defined as an unexpected loss of someone. How many of us have experienced sudden death, where we've seen people go in to the hospital, or we've seen people just had breakfast, just had lunch with somebody, and 24 hours later, they're gone. There's something that we call a trajectory of dying. And one of the first ones that they identify is sudden death. And so in a lot of this, the way that we've experienced loss in this pandemic, a lot of this was sudden, that you went in and you saw your loved one was sick and you thought they were going to come home, but you never got to see them again. You never got to visit the hospital. You never got to speak to them on the phone. All of those things are being troubleshooted throughout and finding different ways to make contact with them. And so I'd like to submit to you that this in itself is traumatic, right? And so it's the loss of someone or something that accompanies a heightened state of mourning. It's an intense sorrow, pain, and rumination over the loss of your loved one. This is also compounded with trauma symptomology. The intensity will differ for each person. It's important that mourning of losses, that we mourn our losses. This process is important. Mourning is experiencing grief for and recognizing the losses one has endured. People mourn in different ways. It requires a capacity to sit with one's feelings of sadness. This begins with an acceptance of the fact that there has been losses. As helpers, as caregivers, it's so important that we understand that we have to leave our mentality of fixing at the door, because this is something that happened and it cannot be fixed. And it is not our responsibility to bring about perspective that a person is not ready for. The fact is that loss has happened, and that has happened suddenly, and it has happened at a rate, and it continues to happen at rates that we can't necessarily bring a lot of logic to. What I'd like to also highlight is the relationship between trauma and mourning in our next slide. We're doing great, Suzanne, with going to the next slides with each other. So the relationship of trauma and mourning is that the loss that you experience in mourning and also in trauma, right? A loss of faith or hope. You experience a loss of joy, a loss of peace, a sense of powerlessness and helplessness. You experience health decompensation, and also experience a lessening of feeling safe, of feeling secure, because things as you knew it, the foundation seems shaky. And that is the trueness of what the perspective of grief and trauma bring. You don't feel safe, you feel hypervigilant, you feel that this is persistent negative beliefs. These are things that trauma is also related to, that is also carried over, and what we can now identify as traumatic bereavement. Is everybody with me, and is this making sense? Awesome. Okay, good. And our next slide, we're going to talk a little bit about, touch a little bit on living with grief in a dual pandemic. And my question, first question is, what is intersectionality? And does it matter in our grief? Does it matter? Intersectionality is a framework for conceptualizing a person, a group of people, or social problem as affected by a number of discriminations and disadvantages. It considers people's overlapping identities and experiences in order to understand the complexity of prejudices they face. I want us to kind of sit with that definition because it matters and how the people that we serve, depending on where you serve, it does matter how they experience grief, right? I want you to keep that traumatic bereavement and also understanding that the dual pandemic, this is compounded onto what they've already been going through, right? This fight that they've had within something that is systemic racism. And so that brings me to our next definition in our next slide. And so systemic racism is described as the presence of racism, as we define, being embedded in the structures of society, whether it be political, economic, legally, medically, or related to employment or housing. It becomes a part of the policies and procedures in which an entity operates. And some updated statistics, we can go to our next slide. As the US continues to grapple with the dual crisis of coronavirus and racism, two things have become clear. When we experienced initially, there was a disparity behind the care that was given to those who were of color and those who were not. So people of color were being hit hardest by the virus, and systemic inequities are largely to blame. Something that I found interesting within CNN News on last year that I'm quoting from, because we've seen some advancements, right? That Black and Latino and Native American people are nearly 3 times as likely to be infected with COVID-19 than their white counterparts. And those 3 groups are about 5 times as likely to be hospitalized, and people of color across the board are more likely to die of the virus. I want to commend those who have been working very hard and tirelessly and at getting out vaccinations and really trying to alter this curve in the way that we've experienced things, because I believe that there has been a shift, but initially there wasn't. The way that hospitals were being overpopulated, the workers that were working tirelessly, and those who were sitting, there were so many different personal stories that I was hearing about from those who were being served at Hartford Hospital and St. Francis, if you're from the Hartford County area, and those who were coming in and who weren't leaving. I'd like to draw our attention to this quote. And she is the author, Rashia Wade. She is the author of Grieving While Black. I mean, if you're looking for a read that you can mix up with something else because it's a heavy read. She says that Black people don't just face death at the barrel of a policeman's gun or within our medical system. Life is taken from us on a daily basis through housing discrimination, right? Through the inability to maintain a job that allows us to pay rent, have health insurance, and buy food, and through undercompensation. If you look at the things that she brings attention to, these are basic needs. These are basic needs. And this again brings light to the dual pandemic. I'd like to also note that we have people that are living in a perpetual state of grief. That even before we experienced this pandemic, we were losing people naturally. We were losing people by organ failure. We were losing people by frailty. We were losing people by sudden death. This is not to traumatize you today, but it is also to put things into perspective that grief was already there and that we live in a perpetual state of grief. This means that we have people living in heartbrokenness, right? And so now we are left as the mourners of those who have departed from this earth, who have transitioned. Dr. Hart Ramsey says it best. He says that a heart broken is a half-hearted life. And so when we are, as caregivers and as helpers, it is our job to listen to that lull and to those moments when it's time for us to care for the soul that's before us, for perspective to be offered. And that brings me into my next slide. And I promise I'm not sure how long I've been talking yet. And I know you guys have an hour meeting, so I'm trying to do my best to give it all to you.
It's just a quarter to 12, Whitney. So you have 15 solid minutes. Take a breath.
Okay, good.
You're doing great though.
Okay, thank you. And so this brings us into caring for the soul. But I also want to tell you that earlier on Wednesday, I had the privilege of speaking about end of life care. And that brought me to a space where I was also to talk about where I said mindfulness matters. This also brought me to a space of understanding that spirituality matters. It's not too many times that we spend as workers and where we can actually bring conversation and light to things that people believe within their souls, right? And so during these times, it's so important that we open up assessment and that we begin to break the silence of the taboo subjects that we don't bring up, because in somebody's ending and somebody's grief, what they're holding on to spiritually, what they believe, oh, it matters. It matters now. At any, it's almost like, when we talk about like bargaining and you're in a pinch, and you just like, people that if we don't believe in God, it's like, Jesus, please give me one more chance, please. And just like you hear that, but that's their moment too. That's their moment too. And it's so important that we find language to allow spirituality to penetrate those moments. So in Care for the Soul, and if I have enough time, I'm going to talk about why spirituality matters. It is required of you to leave your humanistic urge to fix at the door. We are problem solvers by trade. We see an issue, we see grief, we see unhappiness, we want to fix it. You have a housing need, I want to help you. But it's so important that definition of mindfulness that I gave you at the beginning, and I said, please allow that to journey through. Being present focused, it matters so much, and it is valuable to the one that needs it. It's valuable to you. It is essential that we are willing to be creative in our approach to our staff, to our clients, to our patients, and with ourselves. No, we may not all be therapists, and some of these suggestions may not be in your scope of practice. But this is a question about what are you willing to do to ensure that those you are serving are processing through grief healthily with a present help. You are a present help. You are an image of a present help. And it's so important that you see yourself as such, so that you are able to be with your client, and to be present is for you to learn how to navigate those discussions. If you're not present, you'll miss your moment. You'll miss your moment for perspective. You'll miss your moment of when it's important for you to ask about what do they believe, what is their purpose, those things, because those are those deep foundational things that we can help build up from. So the first tab that you see is grief belongs to the griever. And this is just putting things into perspective for ourselves. This is a book that I like to shout out and refer to is, come on, Whitney, you're drawing a blank here. It's Okay That You're Not Okay. That's the name of the book. It's Okay That You're Not Okay. It's a great reference. And what she highlights, I believe her last name Devine, she highlights that grief belongs to the griever. And this means that you have a supporting role, not a central role in the grief. You are a support, you are not central. And it's important that before we go in and before we meet with our clients, it's important that we understand that we are alongside a journey, not a central focus of a journey. You do not have to be the fixer. A valuable question is, what does he, she, or they need in this interaction? What do they need in this interaction? Another thing that I can also capitalize on, what helps us to draw perspective about how to do this, is something called DBT. And this stands for dialectical behavior therapy. And they talk about in that, and interpersonal effectiveness is a module that's there. And they talk about the fast skill and they talk about the give skill. The give skill is others focus. And if you can get your hands on some of that material, it guides you through about how to, one, be gentle. The I meaning to act interested, be present. V meaning validate that moment, validate that client. And E, easy manner. Those are great steps for you to be immersed in the moment with the people that you are supporting, whether it is your patient, whether it is your mom, whether it is your sister, whomever it is. Those are great steps. The next one is do the recurring things. The actual and heavy real work of grieving is not something you can do, but we can lessen the burden. We can be the present help. What is one thing we can do to lighten the load? And it doesn't have to be something extravagant, but what is one thing, as we've entered into that conversation, that we can do to lighten the load? Are we used to just following up with our clients every 2 weeks or every time they missed an appointment? Maybe we have to make a mental note and just, I need to make a phone call to that client weekly. Let me just check in with her. The conversation doesn't have to be long, but really, after people get through all of the arrangements and all the logistics of planning, that is the time where we need to be going in and leaning into that pain and that hurt, because now they're settling and they're settling into a new reality, and it may not be their stage of acceptance. The next part is staying present and state the truth. So many times we want to find the silver lining. Is that what we call it? We want to find the silver lining, and it's not our job to do that. It's our job to stay present and to state the truth. And what does that mean? It's to acknowledge that this hurts and I'm here. That's truth. It is not giving anyone false hope, because all we can do is be present. It's tempting to want to make statements about the past or the future. Stay present even when the present is full of pain. The next one is be reliable. If you're saying you're going to do something during that time, your integrity, it matters here. It matters that, and making sure that we're not making empty promises, which is why it brings us back to state the truth. State what can be and actually what you can do, because this is also heavy for you. The next one is social justice. Continue to be an advocate and continue to educate yourself about those whom you serve. We have to work to normalize grief and understanding it never really stops, right? People have highs and they have lows of it, but then we have anniversaries that come up. A lot of people this year are going through, this is the first time I brought in the new year without my mom, without my grandmother, without my cousin, without this patient that I was seeing for the last 6 months. It's my first new year. This is my first Independence Day, my first Juneteenth. This is all of these firsts that are happening, and people that are going to birthdays and things. It's so important that we understand that this is something that is always carried with them. We just learn how to adjust and navigate differently. And lastly, encourage therapeutic support. Encourage them to speak with somebody individually. Encourage them to get attached to community supports that can also identify with what they're feeling, and also grief support groups. Those things exist, and a lot of them have been existing online. If I can get copies of the things that I have given to my patients, I'll also forward those over to Liz, so you'll have those references for your clients. Encouraging these strategies helps to break down the building of walls that are often built for self-protection and ultimately blocking us from feeling. It's important that we remember that in many communities that we serve, that trauma has already been there, right? And so we don't just get boundaries, we get walls now. We get numbing, we get shutdowns, we get desensitization, we get all of those different things, but encouraging these small steps and us being persistent with how we show, not persistent, but yes, I do mean persistent. Being persistent and present about how we choose to show up. Consistent is what I'm looking for. It helps us to break down those walls. Mindfulness gives us the courage and it gives us compassion to be able to look at our own emotions and worries in the face without fear or defensiveness or judgment. It cuts through our own instincts for self-protection so that we can see our own hearts honestly. I want to read that last point again because you don't have it. It says that mindfulness gives us the courage and the compassion to look our own emotions and worries in the face without fear or defensiveness or judgment. It cuts through our own instincts for self-protection so that we can see our own hearts honestly. In school, as a social worker, we learn, or just going to school to be in the counseling field, we learn a lot about countertransference and transference. It's so important. This is another way in which mindfulness also helps us to check ourselves. We are humans, not superheroes. And so we have to create this space and these moments to check our own emotions and our own worries to ensure that when we are going in to be present with another person that we care about, that we are not blocked by our own self-protection, right? Because a lot of that self-protection can sometimes serve as a wall, not a boundary. I would also, some of the things that I have been going over within supervision and just in conversations, just as a therapist, just in conversation with friends and stuff like that, the differences between boundaries and walls, those things are different. And my last point to you today is that rather than clearing the emotions and our thoughts, we have to look at it as an opportunity to be present in the tension of our emotions. Today, I want to encourage you to begin making those spaces for yourself to not run away from tension, to not run away from hurt or pain, but really understanding that mindfulness is not ways for us to block it out or to distract, but it is our opportunity to healthily lean into tension, to invite pain, and to understand that though this is hard, though this hurts, that joy still exists. And that is our opportunity. In our last slide, I like to do something for all of us, and it is our homecoming as caregivers, as helpers. It's our homecoming. This is our invitation to be able to check our own experiences, and the understanding of countertransference is so necessary. It's the opportunity for us to come home to the truth about ourselves, our own losses, and our own griefs, and how it has affected you in your personal life, but also how it has affected you in your work life. This is important that we recognize that the losses that you've endured and the impact of those losses, including the sadness and including your grief. I would end with this quote, and I believe it is in our last slide. Rashida Wade says, a genuine practice of meditation, it doesn't bring us happiness. That's an unrealistic expectation to expect of meditation. It brings us groundedness and amid chaos so that we are equipped to address our own grief and suffering with inevitably makes us more equipped to address the suffering in our surroundings. I want to read it one more time because I just want to make sure I give the quote justice. She says that a genuine practice of meditation doesn't bring us happiness. It brings us groundedness amid chaos so that we are equipped to address our own grief and suffering, which inevitably makes us more equipped to address the suffering in our surroundings. You should have a copy of some of the things that I chosen to bring up within today's presentation. I just want to say thank you for allowing me to just share space with you all today. I know that I don't hear a lot of talking back, but I want to tell you that I was excited to present to you all today. It's a very sobering topic, but I believe talking about these things is so freeing. So I thank you.
Thank you, Whitney. That was really powerful, and we really appreciate all the work you're doing with your clients and really taking the time out for us today. I can't thank you enough. It's been really a great presentation to hear as we take a day off. Most of us are going to take a day off, and I think that will help ground a few of us as well. So I want to again thank everyone for joining us today. There's some information in the chat, and I know Liz is always great about getting out resources. It's pouring rain here and there's a lot of thunder, so if you hear any weird noises, that's probably what it is. As you know, we have the BOS steering committee in 2 weeks. Here's the schedule, and then we have COVID office hours are always upcoming, and just want to leave space. I know it's just about noon, so if anybody has any questions before we wrap up for the weekend.
Whitney, just lots of appreciation and thanks in the chat box too. I just wanted to let you know you've made a lot of people's days and weekends, and like Alice said, given us so much to think about. I think my shoulders went down like 6 inches just listening to your voice.
Yes, wonderful, Whitney, really wonderful.
Thank you, guys.
Alice, Doc.
Thank you.
I have one thing that I should have said about Unite CT, you guys, is that we have updated a lot. And so now we are using the qualified census tract as a first touch. So people attest to their income. And if they live in a qualified census tract, they do not upload their income documentation. If they do not live in a qualified census tract, they upload 4 weeks of their income documentation or their tax returns. So that requirement's very reduced as well. So there's definitely, we've simplified a lot since this last time I was on this meeting. So just so you know that.
Always good to hear about less administrivia, right? Okay.
Lovely.
Thanks, everyone. Enjoy this 4th of July weekend and rain. And
Cameras on and wave bye to us.
yes. Oh, yes.
Wave
Thank
bye
you.
to Whitney.
Bye, Whitney. Thank you.
Bye, guys. I'm
Sure
gonna
that there's
log
real
off.
people behind those names.
Bye.
Thank you. That was a gift, Whitney. We really appreciate it.
Thank you, Suzanne. I'll see you guys sometime.
We'll see you
in the
again
future.
soon. Yes. Safe everybody this weekend.
Be well.